Okay, so glad you're back. We're going to get crank up here now with part two, and we're going to talk about community education. Laura Shelton has been taking nursing students from Samford for quite a few years now, and so she knows all about this community flip chart. They used to make them great big, but now we make them small enough they'll fit in your backpack, and this is awesome. So if you need one, you can simply call the E3 office in Birmingham and order one. They're $40 a piece, and they will fit in the back of a backpack. And these students that are going, this is a great thing, particularly for the younger ones. So Laura, share with us just a little bit about what's in this flip chart and how they can be used.
I really love the community flip chart, and I would really encourage you to take one on any medical trips, or really just any trips that you're going on. You know, as we talked about earlier, on our medical trips, we're treating really common conditions. And oftentimes when we come into a community, there will be a lot of people that come to the clinic each day, a lot of people that want to be seen. And that wait can be kind of hard sometimes. So using like the community flip chart, we can pull groups to the side, and we can kind of focus on one of the topics in the flip chart. And it really kind of helps to pass the time for folks. So, you know, one that I really like is hand washing. That's a great one to use with a group of kids. And you know, you can also really segue nicely from hand washing into sharing the gospel. Had a group of students a couple of years ago that just did such a great job of talking about kind of washing our hands clean, and then talking about how Jesus makes us clean. And so many things in the flip chart you can flip around to the gospel as well. But hand washing is one I'll use commonly. Also nutrition just focuses on some simple ways to eat a healthy diet. Another one I really like is the oral health, because just common things about how to brush the teeth and how to take care of the teeth, and, you know, kind of limiting sugar and some of those things that are really important. And another one I really like is like talking about back injuries and how to lift properly, because like I mentioned earlier, we oftentimes see a lot of folks with musculoskeletal type pain. And so just talking about some common education and some things that sometimes we take for granted that everyone knows, you know, in some of the areas where we're going, these things aren't common knowledge. So it's really good to provide this education in the community. So I love the flip chart.
Yep. You know, the hand washing thing was kind of interesting. I saw it demonstrated one time in Plano where they took some glitter and put it in their hands. And so they went and they shook hands with somebody, and they said, "Now look at your hand. What's in your hand?" It was glitter. Well, those are germs. Now you go you take that same hand and shake with somebody else. And they did. And they said, "Look at your hand." Of course, there wasn't as much glitter as it was the first time, but every time they shook hands, they were passing germs down the line. That was kind of cool. Also, on the back of the page of the flip chart is a Bible lesson. So it will give something that you can teach from the Bible that the person who's using the flip chart just absolutely can read it, and have their translator translate it. So what the person on the other side is looking at is pictures. It's teaching by pictures, orality. And so everything that you need to know as the trainer is written on the back of the flip chart for you. So they see the picture, you see the script, and it works really, really good. All right, let's move on. Spiritual counseling. Man, this is mine and Jim's big deal right here. We love to do the spiritual counseling thing. Medical is basically used to be a draw, to get people in there so that we can tell them about Jesus. And then after we do that, we invite them to come back to the clinic in the afternoon, and we'll set up little circles and chairs and stuff, and we will actually do a discipleship lesson. So anyway, these are some simple things that we use. Jim, tell them what that little diagram is there.
Some of the different ways we're able to share the gospel when we're in the field is 3 circles, and that's what's in the center of the stage right now. And it's a very simple method by which we can talk through God's love for us and how that will help us when we're in this broken world that we're in. And that the broken world is not where God wanted us, so then he sent his son Jesus, which is what you see in the bottom circle. So we're able to tell the gospel using pictures without words on it, so that someone can able to reshare this, whether they are able to read and write, but they're able to draw quickly through that. And then in the bottom right-hand corner, Sam was talking about how we'll bring them back in to do a discipleship method. We have a simple way to do discipleship. So when you're reading a passage in the Bible, we use some simple questions and ask them, what does the passage tell them about God? And what's the passage tell them about people? And then there's 4 simple questions, and we use what's called SPEC. So whether there's a sin or a promise that they can see in the reading, and then is there an example to follow or a command to obey? And then as we read through the stories, the individuals are able to draw from the story without us having to, quote unquote, preach to them or teach them. We allow the Holy Spirit to teach them themselves.
That's right.
And those stories which will be through what we are calling the commands of Christ. So we have 10 of them that we would start through. The first one would be something along the lines of repentance. So for new believers, so they understand what it means to repent and to turn from their sin. And then the second one would be baptism. So we will explain the importance of baptism, and we use the story from the book of Acts on that. But similarly, we have 10 of these commands of Christ that a new believer would walk through.
Yep. Karina, when you're sitting in a medical chair and you've got a patient sitting in front of you and you realize pretty quick, we didn't bring anything to help them. We can't take care of their physical need. What can you do for them?
So one of the first things, I'm realistic with them. I let them know that the medicine is short-term anyway, but that this medicine sometimes will treat some basic symptoms but won't cure their problem. And then I say, but we can go to God in prayer. We can pray for healing, and we can also pray for peace.
Yeah.
And I say, is there anything else that I can pray with you about? And so we enter into a time of prayer. And make sure they have like their prescription and with their diagnosis, that they can go to the pharmacy in their hand. And then we open up the conversation and I say, I care about you physically, but I care more for your soul. I share my 15-second testimony. I ask them the key, do you have a story like that? And then we can go further along in sharing about Christ if they don't have a personal relationship with him.
Yeah. There's been many a time on a mission trip with Karina, I've walked in the clinic and I've seen her praying with people, and there are times, all these medical professionals can allude to this, there are times that what we bring just simply is not going to help them. I remember Dr. Francis de Thalapati in Peru one year, and he was asked to go do a home visit. And that's not uncommon. We do that almost every trip. We do home visits. But we went to a house, and this lady was eaten up with female cancer. He was a OBGYN, so he knew how to take care of her needs. But when he examined her, he realized she didn't have much longer to go. And he looked at me with tears coming out of his eyes, and he was thinking, what do I do, Sam? And I said, pray with her. Give her a little hope. Give her a little assurance. Let her be truthful with her, but just let her know that God has not forsaken her. He's not left her. And so he did. I remember standing at that bedside with him holding her hand and her husband kneeling down beside her, hugging on her as he prayed with this woman, knowing that her life on earth was coming to a drastic end. So sometimes prayer is what we need to do with these people. Is that spiritual counseling? You bet. Okay. That's important too. That's why we're there. All right. Every person who enters a clinic is going to be registered. Now, we don't normally do the registration ourselves. We allow somebody who's local from a church or a local community that wants to help us will stand at the very beginning of the line, and they will do all of that registration. So they're going to gather very simple information, name, address, telephone number. Now, listen, where we go in Latin America, addresses is going to be a house at the end of the street with a pink door and a German Shepherd on the roof. And that may be the best instruction that we get for that house. So they may just tell us the name of the community, and we just have to ask people who is the Gonzalez family who lives on this street. So hopefully not everybody's named Gonzalez. So we try to get as much information as we can, because remember, we're here today, gone tomorrow. And Now, this is one thing that's kind of funny about Latin America, and I realize not everybody watching this is going to Latin America. Jim, you can tell us this is true or not. They all have a cell phone.
Everywhere.
They may live in a house with a dirt floor and no electricity and no running water, but guess what? They got a cell phone. So you get that phone number for sure, because that's going to help that pastor find these people for doing follow-ups, okay? So they're going to ask a very basic question too. What brought you here? And that will be asked in triage. Now, we don't always get to triage. Now, when Laura goes and she takes Sanford students and Jennifer goes and she brings Central Alabama students, we want them to learn how to triage, because this is basic information that nurses need to know how to do, how to take blood pressures and finger sticks and things of this nature. But we're going to ask them, what brought you here? Laura, am I telling the truth? They want to be seen in every station for everything. True or false?
Yes, that is absolutely true.
That's right. But we may have a line of 250 people waiting on us when we arrive at the place that we're going to do our work that day. And we can't see 250 people every day. So we have to take care of their most biggest need, the thing that brought them there. What brought them there today? And then we will send them to the appropriate stations. Now, if we have a dentist, which we hope we do, and they come with their holding their jaw, that's a pretty good sign, right? So we send them to the dentist, okay? If they come and they say, I can't read, I can't see, we send them to get an eye clinic, okay? If they come and they say, I have a bellyache, we wanted to go and see a doctor, okay? A nurse, an RN, a PA, a nurse practitioner. So we want to get them into one of those seats. So we start to maneuver people around to where they need to go. But typically we are going to ask them for what their number one complaint is. Now, once they sit down in the chair and they start telling you this stuff, we're going to find out they didn't have number one complaint. They had number 15 and 16 and 17. And because we are good, kind-hearted people, we're going to take care of as much as we possibly can. And also sometimes, Karina, tell me if I'm right or wrong. Sometimes a mama comes in and she's got 7 kids tagging along. And so you don't have one person at your station. You got 8, right?
All the time.
All the time.
All the time. Not enough chairs.
Not enough chairs. So you can't just do mama. You got to do all of them, because mama's got to be there for the kids too. So it gets a little bit hairy, but you know what? It's so rewarding. It's so rewarding to see these people get their needs taken care of. But that clinic form is very, very important. Now, there will be a clinic form in the Google Drive, okay? Now, a doctor, a cardiologist from Birmingham, Bill Rogers, several years ago, he went with the Sanford team down to a place called Pisco, Peru, and he asked to look at our form. So I sent it to him. And he said, can I make alterations to it? And I said, sure, Bill, you can do whatever you want to. Well, you know what he did? He took the very top where it had name, address, telephone number, blah, 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 and he inserted in that, somebody shared the gospel with me today. This was my decision. No decision. I accepted Jesus. I'm already a believer, but I need someone to follow up with me. He put all that in that information block. So now your clinic card also is your decision card. So that will be in the Google Drive. So you can use it. You can tweak it however you want to. It is an editable document. So if you need to change your medicines are listed on the back. You can go in there and you can edit whatever you need to do there. Maybe you don't take 500 milligrams of something. You take 250s. That's fine. You can change it. Maybe on the front where we have diagnoses where the doctors can just check that off or circle it, or the triage people can put on there, this is what they came in with: headaches, vomiting, diarrhea, whatever. Maybe there's something that we missed. Now, I don't think we did, because I've had a bunch of good professional eyes look at this thing year after year. But if you see something we missed, it is editable, and you can go in there and you can tweak it the way you want to, okay? But that's a good document that you need. You print 2 on a piece of paper, whack it in half, take a master copy with you. You can probably print in country, so you're not having to carry 1,000 pounds of paper with you, okay? So that's the clinic form. Follow up. This is so important. Now, sometimes the follow-up is needed in a medical capacity because we found somebody who had something that they need treatment after we go home. I'm going to tell you a little quick story. I was in Namasigüe, Honduras, and this was before I came on staff with E3. The very first day of clinic, this man came in and he had a towel wrapped around from his chin up to the top of his head, and little bunny ears. He looked like Marley from the movie Scrooge. And it was bloody. It was awful. So one of our docs was able to remove it and looked at it, and this part of his chin was missing. And we asked him, and he told us the best he could through that broken jaw, "What happened to you?" And he said, "My mule kicked me." And when that mule kicked him, it knocked off a part of that chin bone right there and some of the flesh. And it had been like this for a couple of days. It was nasty. Those guys were able to debride it and stitch a little bit of skin to muscle and stuff to try to make it hang on. And they gave him antibiotics. They cleaned it up the best they could. They dressed it really nice. And they told him, "Tomorrow, we're going to be in this village. Can you come there?" Yes. And so he followed us, and he followed us, and he followed us, and he followed us. But we only had 5 days of medical ministry, not 6, 7, or 8, 5. So what happened to this guy? We had to find somebody locally who could continue to dress his wounds, to administer his antibiotics, and to help him through his process of being healed. Do you think that guy was a happy man? We were getting air kisses, everybody, men, women, children, everybody's getting hugs and kisses from this guy because we followed with him and showed him the love of Jesus. But not only do we need medical follow-up sometimes, and that's why it's so important. Jennifer was very instrumental this past year in Honduras to recruit people that she knew from down the southern part of Honduras. She got them to come up, the medical doctors and the medical students, and they joined us because they were able to connect them with local doctors to help do follow-up. You can't do that every time, but when you can, it's a real, real blessing, okay? But there's the other type of follow-up, right, Jim?
Yes, sir. We need to make sure that we are able to get pastors or other people from the church to know who the people are so they can continue to follow up with discipleship. We don't want to just, when I first came on staff, it was like I was told, for brand new babies, you won't leave the baby along the side of the road. So what you want to do is make sure we have pastors or, I said, people from the local church are going to come along and continue to help them learn to feed themselves reading the Word.
Yeah, that's one thing that drew me to E3. You know, when I decided to leave my ministry at Pelham after 21 years, that I was going to be a missionary, God really dealt with me for 3 years to do that. And one thing that drew me to E3 was the fact that discipleship is such an important part of the ministry. So, you know, I interviewed with 2 other organizations, 2 other ministries, and evangelism was their key thing, but they did very little in the way of discipleship after the fact. And, you know, I love the fact that we do discipleship with these people. So again, on that clinic card will be not only their name and so forth, but if they come to the clinic and they get saved, then we're going to be able to indicate on there what happened, who talked to them, what did they do. So there'll be a form there. Evangelism people, if you're taking the evangelism training, which is another complete different litmus group, then you're going to find out how to do that. How do you keep up with the people who get saved? All right, let's keep moving on. So this is just a picture of a follow-up that's going to be taken care of. This was in Honduras, and there's not an American in there. These are Hondurans. That guy's name is Maynard. And Maynard is there doing a Bible study at the end of a day after people were seen in their home, after they were evangelized. Maybe they went to the medical clinic in Copan Ruinas because Maynard was with us. And here these people have come back because they wanted to hear more about Jesus. They wanted to hear his story. So follow-up is super, super, super important. Well, I think that pretty much takes care of our training for this particular segment. And I do appreciate my friends who helped me tonight for Jennifer has come back. Her video went away for a while. I didn't know if you were with us or not. And there's Karina and Jim and Laura and myself. And I appreciate them being with us. This made this training a whole much more enjoyable for me, and I hope for you too. Now, you're going to have to go through a lot of segments like this, so just don't delete them once you record them. Just keep them and don't delete them because you may need it in the future. And we hope you do well. You are going to get a test. The 5 people who are on this line are going to develop some questions based on what we talked about, and you're going to have to take a test. And if you pass that test, then you get to keep going. If you fail the test, you got to do it all over again. So I hope you do real well so that you too can be a clinic administrator at some time. Take care. God bless.